Namaste. I'm Dr. Vaishali Bhide, MD Homeopathy, and today we will be talking about kidney stones. So, kidney stones are a very common complaint that we see in our practice. Around 15 to 20% of our population will get stones at some point of time in their life. 80% of these stones are made up of calcium oxalate or calcium phosphate, and the remaining 20% are made up of uric acid maximally. So, what causes a predisposition to these stones, or what is a risk factor? Drinking less water, or the habit of drinking less water, is one of the commonest predisposing factors. Diabetes and obesity will increase your risk of getting the stones. So, why kidney stones form? All the fluids have a certain pH. Similarly, the urine that we pass also has a certain pH. When the pH of the urine drops, crystal deposition starts. These crystals clump together to form stones. So this is how, and this is why stones are formed. So when we drink less water, the pH of the urine drops and stone deposition occurs. What are the symptoms of stones, of kidney stones? Most importantly, when the stone is smaller in size, they are asymptomatic, which means even the patient himself is not aware that there is a stone. However, when the size of the stone will increase, or when it will start to pass out of the ureter, through the ureter, that is the time most severe symptoms are felt. Kidney stone colic, or a pain which comes when the kidney stone is passing, is one of the most severe pain a person or a patient will ever experience in his life. The pain is typically, as we call it, starts in the back and comes right till the groin. In our medical lingo, we call it a loin to groin pain. This pain may be associated with nausea, vomiting, and restlessness. This is how a kidney stone will present. So, what can we do to prevent these stones? Most importantly, the most important lifestyle modification is increase in quantity of drinking water. Around 2.5 to 3 liters per day should be ideal. Along with that, if you had stones in the past, then you should avoid taking high calcium or high protein supplement unless recommended by a health professional. If your uric acid levels are high, then it is good to avoid or limit the intake of non-veg food. Homeopathic treatment of stones. In homeopathy, we will take a detailed case when the person is not in acute pain. After the medicine, what we expect is that the size of the stone will reduce and it will pass out in the urine. Secondly, what we try to achieve is that the tendency to form stones should also reduce. Along with the medicine, it is important to drink plenty of water. Increasing your water intake is as important as taking the medicine.